Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit system of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Rachel Colasino, and my guests for today's show are Maria Kraft, Administrator of Mount Greylock Extended Care Facility, and Jenny Sutherland, Activities Director at Mount Greylock. Welcome, ladies.
Hi. Thank you.
Thank you for being here.
Thanks for having us.
We have a very fun topic today, and that is National Nursing Home Week. And Mount Greylock celebrates it, in my opinion, in some of the best ways that I've ever seen. So we're going to talk about that today. And Nursing Home Week is observed in skilled nursing homes throughout the country. The week starts on Mother's Day, which is Sunday, May 12th, continues through to next Saturday, May 18th. And Nursing Home Week recognizes residents and patients in long-term and post-acute care settings and the staff who care for them. So the observance is an opportunity to involve families and community members in a way to show support and respect for the staff and for the people who live in nursing homes. So Maria, I'd like to start with you. As the administrator of Mount Greylock, what value do you place on National Nursing Home Week and the celebrations for the patients and the residents and the staff?
We put a large value on that because, as you stated, it is a celebration for everyone that is involved in nursing home care, whether they live there or they work there. And we take pride in having our staff become involved in the planning. It's not something that we, as the managers of the facility, say, this is what we're going to do to celebrate. We involve the staff in it, and they help us to choose the celebration that we want to do throughout the week. It is our largest event of the year. It encompasses not only the staff, but the residents and their families, and we even have the community come in and they participate in the week-long celebration. It's a way to recognize our staff for the phenomenal job that they do in an industry that is still not understood by a lot of people, and it's also a recognition for the residents and the families that live there to let them know that nursing homes are a great place to live in, as well as for the staff to work. So we try to combine that with everybody, and it works out to be a great week. Everybody helps to plan. We have staff that come in on their days off to help with some of our events as well. So
That's
it's
great.
Nice.
And I've heard you use the word pride before when you talk especially about the staff, that staff are proud to work at Mount Greylock. Can you talk about that a little bit?
They are proud. We have many levels of care providers in our facility, from nursing assistants to registered nurses, as well as housekeepers' activities, dietary managers, laundry, and maintenance, and they all work together, and they make it a place where that the families enjoy coming to visit the residents. They enjoy bringing their families in to participate in some of our events as well, and they're proud to let the community know that Mount Greylock is a great place. They deliver wonderful care. It is a great place to work and live.
Great. So can you walk me through the celebrations and how those are planned? And I know you've mentioned that everybody is involved and different departments are involved, but what does that actually look like?
I've been in the industry a very long time, and it has evolved quite over the past several years, and very much so at Mount Greylock, where it's no longer just a week of the managers decided this is what we want to do today. We have a workforce development team that works very closely together with the management team and helps to bring the staff and the managers together to work on projects. They are the ones that a lot of times come up with a lot of the events that we want to do throughout the week. And they start planning these early in the year. So if something goes on really well, we'll test pilot an event, and if it works well, we'll do it again during Nursing Home Week. And we'll do it in such with Jenny and her department so that we can incorporate the residents and the families in as well, so that it's a team effort to put the events together.
And you had given me the example that for something, an activity like a cookout, you would think it would definitely be the dietary department, but then other departments are involved as well. So, for example, housekeeping, or Jenny's department, the activities department.
That's correct, because not only do we just cook the food and serve it, but there's a lot of decorating that goes along with it, and many times there's a theme. Those we've had Cowboy Day, or have a hoedown, and we're going to have a luau this year. And so there's themes that go with each day of the week. So there's a lot of preparation that goes in, and there's little teams that are broken up, and each team is responsible for making sure that that day has every aspect of that event covered. So it's a team effort. So activities, it has a little piece in every activity that we're doing through the week, but maintenance, housekeeping, and even the kitchen is a big piece of it, because a lot of it does evolve around food and celebrating. So.
And families are involved?
Families are involved. Many of them volunteer, especially once the calendar of events goes up on the wall and they see something that they'd like to do. If it's a specialty on their part, they most certainly will come to Jenny or myself and say that they'd like to add something to our celebration. They're always invited to participate, just like we would have the residents, but there's many who like to give back for the care that they receive, for their loved ones that they receive. So we invite everybody to help with every event. We actually even have some vendors that sometimes will donate something towards one of our events as well. Our hairdresser, who's there every day, is part of the team, and the family is also helping to participate in the planning of some of our events this year.
So, Maria, do you see any changes in residents or staff during this special week?
We mentioned Pride earlier, and I think this is the week where we start to see how proud the staff is, and how much they actually truly can give to the residents, more so than just the daily activities of daily living that they do every day, but to participate in an event that they know that the residents love and have done when they were younger. It's something that they feel adds to their life, and it's both ways. They really, really become involved in these activities, and it's heartwarming to watch them interact with the residents. And the residents, they talk about it for weeks afterwards, and how great of a time they had.
That's great. So I'm imagining that there are probably different levels of participation, especially for the residents.
Yes, there is. And some will actually participate and get their hands right in it. And others prefer to just sit and observe, but it's their way of being there, and they just might kick in a few ideas here and there, but just observing, it raises their spirits very much. And you see the smiles on their faces on every level, whether they're right in the thick of it or they're just sitting back and enjoying the entertainment for the day.
And I'm imagining that even though this week is very special, it probably continues when the week is over, and those good feelings last, I'm assuming.
They do, because then this is almost like a kickoff to spring and summer and many of the other events that we have planned throughout the year. It starts with the residents and the families coming into the facility and being with the staff, and then we roll into summer and we have a picnic. So it evolves into a lot more, and more ideas come out of this week. That's things that we can try, so that we do them throughout the summer and into the fall, and start planning again for next year.
Great. So Jenny, I know you have a lot to add.
I do.
So let's start with, just paint the picture for us. How is the building decorated? How is it different from other times during the year?
Well, this year we came up with going with the luau theme. So the different areas of the building, the units, the library, the lobby, the activity room will all be decorated all week for luau. And then we have a wedding that we're having, a recommitment ceremony. So our dining room will be set up for a couple days, like a chapel and a reception area, to get people interested and psyched up for the different things. But people like to decorate, and it's a lot of fun. It reminds you of summer's coming, and we're just going for that theme.
Do you have any decorating contests?
We do. Whose area is luau'd out the best?
Okay.
And people are going to dress up with that theme as well. So
Okay.
hopefully activities will win. And the wedding, I think everybody is super excited to set up the dining room for the big weddings that we're having.
So yeah, so let's talk about the wedding. I know that's part of the activities that you have planned, but it's a
Sure.
major one.
Yeah, well, I'll back up. We're going to start National Nursing Home Week off on Sunday, Mother's Day. We've invited families to come to a tea and some entertainment, so that'll be a nice way to open that up. And the staff who are working are also included in that, so everyone will be together. Monday is Pajama Day, one of my favorites. We're having a big breakfast social for everybody, staff and residents together, and it's Trivia Day. So throughout the day there'll be trivia questions and staff and residents can win prizes. And in the afternoon we have 2 trivia teams going head to head in Wait, I Know That. It's made up of a couple of managers, hourly staff, and residents. So, and they win a luncheon party together that they picked. They thought that would be nice, the winning team, to spend time together. On Tuesday, probably the thing that the staff and residents are most looking forward to is we have 5 couples where one of the residents lives at Mount Greylock and the other one out in the community are getting remarried. So we have hair and makeup being done, flowers, music. We have a reverend coming in. Families are invited. Staff are coming in on their days off. We have volunteers coming in. It should be a lot of fun.
That's so special.
Yeah.
Yeah.
I think when we're talking about pride and a life at Mount Greylock, so many of us want to support these couples where they have to live apart and respect their relationships that they still have and try to support that. So we're very excited about the 5 couples renewing their vows. We're going to have a big cake reception. So that'll be very fun. Wednesday, I know my boss here is nervous. We're having a cook-off, and Maria Kraft will be taking on our dietary manager in a 1-hour-long cook-off where they must make an appetizer, an entree, and a dessert using my secret ingredient.
So the secret ingredient, let's talk about that. I know we can't tell Maria what it is,
No, I'm not doing that.
but what might an example be?
Well, an example might be that I would give them, say, a variety of different kinds of peppers to cook with. So in their appetizer, they might use a hot pepper. In their entree, sweet peppers. And I'm not sure what you do with peppers in a dessert, but don't have to worry about it because that's not the secret ingredient. But you nervous?
Yes.
Yeah, you should be.
Because I still don't have my menu. I have no idea what I'm cooking yet all the way through. So with that and the challenge of the secret ingredient, it's going to be interesting.
Well, if you think you're nervous, the 3 judges who are all family members of the residents are a little nervous too. And Thursday is our luau day, so that ties in the theme of our decorations with a dress-up day, and we're having a big luau luncheon for staff and the residents and family. Friday, we're doing That's Hollywood, where we dress up as our favorite Hollywood actors or actresses, and we're going to do some awards for residents and staff. And we're bringing it all the way into Saturday with a tag sale to raise money for the Resident Activity Fund, and I brought some examples.
Oh, great. Yeah, let's
over
talk
here
about the
that-
tag sale.
Yeah, well, you can purchase these little goodies at Mount Greylock's tag sale. And if you didn't like that first side, you could perhaps go with the other side.
How much would that be, Jenny?
Well, 2-sided thingamajig like this, I'd say $1.
Okay.
All right, would you pay $1?
I would.
You would, no more though, huh? No. Okay. All right, then I have this cookie jar, cow cookie jar, complete with a lid.
Nice.
More than $1?
$2.
$2, okay. And then this brand new, never been used, drink cooler container.
Nice.
Pretty cool.
So
Yeah.
all examples that will be at the tag
Yeah,
sale.
many more things at the tag sale as well, so hopefully.
And that's open to the public?
Open to the public. We've already had some people calling because they heard that it was going to go on, so the community's getting excited, families are excited, residents and staff, so it should be a good week.
Great. So, Jenny, can you talk to me about the special volunteer program that we run with staff members of the Berkshire Healthcare Home Office?
Oh, sure. What a great pleasure to talk about that. Home Office came up with this idea and approached us. They wanted to volunteer at one of the affiliates, and super psyched that they picked us because it's just a pleasure to work with them. Those folks do so many things every day for the residents and for the staff to make our lives and our jobs go better, and it's nice for them to see what their work is affecting the residents and the staff. And I think it really truly connects their hearts and their minds together. And you know, these folks come from Central Block down to Mount, and they're playing games with the residents, going shopping, and you know, I'm doing seeing smiles. The residents and the home office volunteers. So I can't thank them enough, and what a real treat to get to know them in a different way as well. So
that's great.
Yeah.
So we are going to take a short break. We're going to learn a little bit more about Mount Greylock, and then we'll be right back.
Nestled near the wooded and serene Springside Park, Mount Greylock Extended Care Facility is just minutes from downtown Pittsfield, in the heart of the beautiful and culturally rich Berkshire County in western Massachusetts. Mount Greylock Extended Care Facility offers you the best of both worlds. It's a locally run facility, staffed by dedicated healthcare professionals from the central Berkshire area. And it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in the area. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Mount Greylock is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Mount Greylock, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice, and respite care services. We proudly offer an elegant home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Mount Greylock is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident at Mount Greylock receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Mount Greylock Extended Care Facility, we're perfecting the art of superior care. If you or a loved one need short-term rehab, extra care after a hospital stay, or a nursing supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-499-7186. We look forward to meeting you.
Welcome back. So I am here with Maria Kraft and Jenny Sutherland from Mount Greylock Extended Care Facility, and we are talking about the very special ways that Mount Greylock celebrates National Nursing Home Week, and we are wearing costumes. So, Jenny, why are we wearing costumes?
Oh, that's a fine question. We are wearing some costumes that we will be wearing during National Nursing Home Week.
Okay.
I am wearing the luau wear. The boss here is wearing her outfit for the cook-off, her Top Chef cook-off.
Great.
And Rachel, you are decked out for That's Hollywood. And now I do call you Mary Tyler Moore.
You do.
So who are you dressed up as?
Mary Tyler
Yeah, and
Moore.
you look very nice as Mary Tyler Moore.
Thank you. So Jenny, I understand besides the costumes, you have another surprise for us today. So what is that?
All right. Well, I thought we'd play a little game here and turn the tables.
Great.
So we're going to give you a chance to see what our wait, I know that trivia game is like, Rachel.
Okay,
So would you
great.
like to play?
I would like to play.
So here is the deal. I'm going to ask you a series of questions. You get 3 out of the 5 correct, and you win a prize.
Okay.
Yeah.
All right.
Feeling confident? Now, I know you are a runner. You enjoy running.
I do.
You do. Okay. So for you, I chose the category of Baby You Were Born to Run.
Okay, great.
Okay. Do you like Bruce Springsteen?
I do.
Well, unfortunately for you, none of the questions are about Bruce Springsteen. They are about 2 of Warner Brother cartoon characters, famous runners, the Roadrunner and Wile E. Coyote.
Okay, all right.
Yeah. You ready to play?
I'm ready.
Okay, here we go. Your first question.
Yes.
The Roadrunner can only run on what? Usually the first question's the easiest. It's the icebreaker. The Roadrunner.
His feet.
The Roadrunner can only run on...
The road.
The road! Okay, we didn't have to go to the camera, guys. 1 down, 4 to go. Now, Rachel.
So obviously we haven't rehearsed this.
You're doing fine.
Okay.
You got one right.
Okay.
You can get a hint.
Okay.
Okay. What does the E in Wile E. Coyote stand for? Now, I'll give you some choices.
Okay.
Earl, Elton, Ethelbert, or Edgar?
B.
Earl, Elton, Ethelbert, or Edgar?
Edgar.
Earl. It's Ethelbert. Okay, it's all right. It's 1 for 1.
It's okay. I only have to get 3 right.
Ethelbert is a combination of the Warner Brothers parents' names,
Oh.
Ethel and Albert.
Okay.
Just so you know next time. All right, number 3. The Roadrunner can't harm the coyote except for when he says, rhymes with what I drive.
Beep. Beep, beep.
You said beep beep on TV. Correct. Awesome. You're doing great. 2 more to go.
Okay.
Besides the Roadrunner, this force of nature is Wile Ethelbert Coyote's greatest enemy. Natural enemy in nature. Oh, do, 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 do. You can pull the cameraman.
Give me a hint. Gravity.
Gravity! It's either he's falling or something's falling on him. Now this one, I know you're going to get this one.
Okay.
You are a pretty good shopper.
Okay,
You yes,
yes.
you do shop.
Yes.
We know you do.
Yes.
This is the name of the mail order company that Wile E.
Acme.
You have to, okay. You got that right. Very good. Boss, how did Rachel do?
She got 4 out of 5.
Yeah, you won our prize for you. You have the golden running sneaker. Congratulations.
That's great.
If you want the other one, I'll spray paint it. You can have a pair.
Thank you.
You're welcome. Thanks for playing.
So, thank you, Jenny. That was great. And my last question for you is, I have heard you say that Mount Greylock is a place where life happens. So what does that mean?
Well, Mount Greylock is a home for the residents, a home for their families and friends when they come to visit their loved one. Certainly a home for the staff. We spend a lot of time at the facility, and life happens there. During this week of National Nursing Home Week, we're celebrating each other, ourselves, being together, the hard work and the hard lives that we live there. And certainly I think, again, the wedding is a big hats off to respecting people's lives. But, you know, life does happen there every day in activities, in dietary, in nursing. People are still doing their thing. So hopefully this week we'll be celebrating a lot of that life. So
That's great.
yeah.
Great.
Thanks.
Well, thank you both for being here. And this has been InfoSource, a presentation of Berkshire Healthcare Systems.